Hi, my name is Tina. I've had Crohn's disease for the last 13 years. I was originally diagnosed with ulcerative colitis in 2006, and that diagnosis was changed to Crohn's disease in 2011 when I received a diagnosis of a fistula, which is a complication of my disease.
I'm Anand. I'm Tina's husband. I try to be as supportive as I can to Tina through her journey.
I was 22 years old. I had felt like my life was in free fall when it should have had been in upward trajectory. But over the years, I've learned what true success means to me. It means reinventing myself in the face of multiple surgeries. I've had over 20 in a 7-year period with my Crohn's disease.
Hi, my name is Damacy. I was diagnosed with ulcerative colitis when I was 15. I've had around 23 surgeries. Former athlete, I played basketball through high school and college. I loved basketball so much I even played with my stoma bag and would just ace bandage some padding around me and hit the court and play. It was hard for me to deal with it just because it was a ton of emotions at once I think I was 17 at the time, for a 17-year-old to try to understand. I'd be going to school constantly sick and in and out of school. I tried a myriad of different drugs, from steroids to other types of immunosuppressants to see if that would help. Nothing was really working, so then we started seeing different surgeons and seeing what the surgical options were.
I had multiple surgeries in emergency, unfortunately. It was very difficult for me to grapple with the idea of having surgery so suddenly, but at times I had already known that I needed it. So it was this process of coming to terms with, okay, this is what I need to get better. And that's how I kind of approached surgery, is this might save my life.
Studies show that about 1/3 of patients with ulcerative colitis and 3/4 of patients with Crohn's disease will require surgery in their lifetime. My name is Lexi Sherman. I'm a certified woundostomy continence nurse, and I've been living with Crohn's disease for 31 years. There are a lot of fears that patients undergoing surgery can have. Naturally, with any kind of surgery, surgery is a very scary thing. Talking to your surgeon prior to surgery about your concerns, as well as finding a great support system, can really help you.
Preparing for surgery, I consulted with a number of online support groups. I also visited some in-person support groups with the Crohn's and Colitis Foundation, as well as my local hospital, to really understand what an ostomy would be like, or to really understand what a J-pouch might be like. And I learned from other people's experiences how to empower myself. I learned that I'm not alone in this IBD journey of mine. Even though our experiences might have been different, I heard from them how they managed, what kinds of things they ate before and after surgery, or if they used a fleet enema or certain kinds of medication. And that really empowered me to discuss with my doctors, with my surgeons, if that was the right course of action for me as well.
I was fortunate enough that my mother let me make the big decision to have the surgery or not when I was 17, and that is a huge decision to make because there are a lot of long-term ramifications. Being an advocate for myself, I realized early on that I wasn't necessarily getting the best medical attention that I needed, so I ended up switching my surgical team to my current surgeon that I still have, and he is the best. Once he healed me, he came to my college basketball games. You can't ask for a better surgeon. So it was a lot of sitting with him, having really long, in-depth conversations of what my options are, what they look like, and then trying to cater a plan that not only would give me the best quality of life, but the best quality of life for what I want to do. And he knew how badly I wanted to play basketball through college, so he found a way to do my operations around that, which was amazing.
In the beginning, I was working mainly with a gastroenterologist. As I came close to needing surgery, I got a surgical consult, but I also started working with the surgeon much more closely and his staff more closely to understand how to give me better quality of life.
Prior to surgery, it's important to ask your surgeon how many inflammatory bowel disease patients do they operate on every year? What are the risks and benefits of surgery? And are they able to do laparoscopic, or do they only do open operations?
Looking back, I'd say there's a few things I wish I knew about surgery. A lot of times you focus so much on the physical and getting better because it's a little bit easier to control, like if I do 30 push-ups and eat this much food, I'll gain weight and get strong. But it's a lot harder to find the way to strengthen your mental and emotional after going through something like that. So it's a lot of finding what you need, whether that be therapy to talk through the changes that happened, or finding a support circle or others who are going through similar things to talk with. But in general, I'd say you can always look back and say, I know how important my health is and I have that now, so everything else I can deal with.
It's really important to give yourself time to adjust to all the changes, not only physically but mentally and emotionally. It's important to reach out and use resources like the Crohn's and Colitis Foundation support systems, or a Power of Two buddy, or a good friend that you feel like you can confide in, and have that support team and someone to encourage you and get you up and moving and walking around.
I think it's important for you to just be as supportive as you can, to be your earpiece for them to speak to or a shoulder to lean on. It's our responsibility as caregivers to ensure that we're an anchor for them, a foundation for them to lean on, to give them the strength that they need to push through their process.
Even though I needed repeated surgeries, repeated medications, over time, surgery gave me so much quality of life back. For instance, I remember my J pouch, when it was taken down, connected to my rectum, all of a sudden I had this sensation to go after several months of not being able to go and going through an ostomy bag. And it felt miraculous for me.
If I could give one piece of advice to someone, it would be to hang in there. It can seem like it's going to be so dark. If there's surgery after surgery, you don't know when it's going to end. You don't know when you're going to feel better, but there's always light at the end of the tunnel. And one other thing that's really important is that it's good to understand that it's okay to not be okay all the time. There's going to be times when you're very sad, you're very sick, you don't feel well, and that's okay too. But as long as you keep in mind that it's cyclical and you will get better and things will get better, I think that's most important.
Undergoing surgery for ulcerative colitis and Crohn's disease is challenging, but myself and thousands of other patients that I've taken care of have gotten through it, and with time and adjustment, you will get through it too.